So I'm Paul Wallace. I'm the Chief Medical Officer here at Optum Labs. We're a research and innovation organization. We're founded on three basic principles of creating access to robust data drawn from administrative claims, clinical data, and consumer data. We combine that with a strategy to attract partners from across healthcare. We're co-founded with Mayo Clinic, but we have about 23 partners drawn from academia, healthcare delivery systems, life sciences companies, and technology companies, along with consumer advocates. We combine that with a philosophy, really, of the learning healthcare system of blending together the opportunity to generate knowledge with the needs of the users of the knowledge, particularly clinicians at the front line. So that's reflected in how we approach problems and also how we engage our partners. We see ourselves as really supporting the both and of how we can create access to big data resources to support traditional approaches to research, and how we can support investigators from our partner and other institutions in having access to really a unique, robust data resource that allows them to pursue problem formulations that are amenable to observational research, and also help us think about how we can stretch that paradigm over time. We also work with our partners to collaborate on larger national and international initiatives to get our heads and research efforts around some very big problems like comorbidity, how we can create novel performance measures, how we can come up with new paradigms for thinking about Alzheimer's disease, how we can manage chronic comorbidity. And doing that collaboratively through a portfolio of projects that draw across a variety of different problem formulations and approaches. So I'm personally fairly hopeful that within 10 to 15 years we can see a transition from the way that we've traditionally thought about and sought knowledge from the supply side to a much more cohesive approach between the users of knowledge and the generators of knowledge. And I think that's also facilitated because we can, using the data resources and analytic techniques that are evolving, answer many, many, many more questions in a period of time with a given unit of effort than we could historically. So we can be much more responsive to the needs of the front line, and hence I hope be much more relevant. So, and I think that we're seeking, along with a variety of other places, to think about how can we create that infrastructure in a way that is both accessible but also sustainable.